state board requirements in New York for informed consent include your qualifications as a licensed professional and the qualifications of any of the staff that are employed or that might be treating the patient as well. Your requirement to report suspected child abuse and maltreatment or crimes in compliance with applicable state and federal laws and regulations, as well as a list of the services you provide at your practice, along with situations in which you may seek the patient's consent to consult with another licensed colleague or refer for supplementary treatment. I found an informed consent form for professional counselor Christina L. Germ in Baldwinsville, New York. In her form, she lists her qualifications and experience. She then reviews the risks and benefits of therapy, the confidentiality agreement, but also lists exceptions to the confidentiality, like harm to yourself or others, abuse, and other things that are required by law to be reported. She touches on technology and confidentiality, the use of social media and internet, the issues with recording during a session, and possible consultation with other providers. She speaks on the use of insurance and fees, as well as her cancellation policy and late attendance policy. She also briefly touches on litigation limitations, therapist availability in emergencies, including a crisis hotline. She also talks about the process of therapy, the duration and termination of therapy, and then at the end she speaks on HIPAA regarding her practice. In the ACA Code of Ethics, A.2.B, clients have the freedom to choose whether to enter into or remain in a counseling relationship and need adequate information about the counseling process and the counselor. Counselors have an obligation to review in writing and verbally with clients the right and responsibility of both counselors and clients. It is important for both the counselor and client because, as is shown in the article by Jim Probert in 2021, students at the University of Florida Counseling Wellness Center internship program were afraid that if they did anything unconventional that they would be fired. So the program implemented seminars giving them greater knowledge on informed consent so that they are protected in a counseling relationship. Informed consent is an ongoing part of the counseling process, and counselors appropriately document discussions of informed consent throughout the counseling relationship. But when compared to the above informed consent, it shows that Christina L. Germ takes into account both the ACA Code of Ethics and the state board requirements. She actually has more in her informed consent, making all of her information easily accessible to the patient. In other words, she's completely transparent with the patients before she starts their counseling sessions.